So I think that Patricia and I will now ask the questions that have come in through the chat. Please keep the questions coming in. We've got a few so far, but it would be good for us to have a really lively discussion here. So can we start? I'm going to ask Bakita, I've got a couple of questions for you. The first one is from Annette Harble, and she has asked, in terms of exclusive breastfeeding, could you comment on the BEVA recommendations for a longer breastfeeding period, e.g. more than 6 months? Infants might need additional solid food, then I don't see why mothers should stop breastfeeding for this reason. And she also thanks you for your great presentation. So that's her first question. And then I have another one for you too, Bakita.
Okay, thank you so much for the question. As the question suggests, that currently the UK infant feeding guidelines recommend exclusive breastfeeding for the first 6 months if a mother or birthing parent chooses to breastfeed, and that is based on the evidence that is suggesting that there might be increased risk of transmission if there is combi feeding. But I've got the BEVA guidelines up in front of me, and it does actually state that weaning to solids or formula does not need to be abrupt if the mother has an undetectable viral load. But in terms of the current infant feeding guidelines as they currently stand, I don't think it would necessarily be my place to comment on those. In terms of the data, we did have 3 women who breastfed beyond the 6 months, and their healthcare professionals supported them in that decision. And 2 of them reported actually choosing to stop breastfeeding when they felt that actually they needed to introduce solids into their babies' diets. So hopefully that is clear.
And the second question is, what was the reason? So the second question, is from Melanie Murray, and she wanted to know, was there any transmission of HIV in the study? And did the women in the study maintain an undetectable viral load? And can I add to that, did they also attend regularly for their viral load checks? Bakita, did you hear that question?
Was that question to Lina?
That was directed to you.
Yes, so could you repeat the first part of the question, please?
So were there any transmissions?
There were none reported, no.
Yeah.
And they had, so the women who had attended, so the current guidelines state that if a woman is breastfeeding, they should attend viral load testing every month. And the women that were breastfeeding or had experienced breastfeeding were doing so. Some commented on the difficulty around that logistically, but they were still meeting their monthly appointments as reported by them.
And Bakita, can I ask you one supplementary question to that, which is, did you follow up on the women who chose to formula feed to see whether they regretted their decision, whether they perhaps had also perhaps breastfed as well, although they were predominantly formula feeding?
So the interviews happened, it was a snapshot in terms of the interview. Okay. So we either interviewed participants when they were pregnant or whilst they were formula feeding. Nobody reported, if they'd stated that they'd formula fed, nobody had reported that they had changed their mind and breastfed. However, there were participants who had intended to breastfeed and then after birth had reported that they had had to formula feed due to difficulties with breastfeeding, either cracked nipples, latching or lactating, which raises, I think, a question around the support that might be on offer for women who do choose to breastfeed.
And I've got one supplementary question from Karen Hampanda. You're getting lots of questions here, Bakita. When do you think the UK guidelines will be updated? Do you think it's imminent, or are we going to wait a long time?
I think it's difficult to answer that question, but I do know that the members, so the guidelines were updated in 2018 to state that women who have an undetectable viral load will be supported to breastfeed if they choose to do so. And I know that the Beaver Pregnancy Working Group regularly updates their guidelines. So there are interim revisions every so often. And there'll be another revision towards the end of this year. But in terms of the specifics of how that might change in terms of the infant feeding guidelines, that isn't something that I would be in a position to comment on.
I think the next question is for Leela, so I'll hand over to Patricia. I don't know, have we lost you, Patricia? Okay, so I'll pick this up again. So it's a question from Krista, and she thanks Bakita and Leela for great presentations around infant feeding and HIV. She is from the Well Project, and they recently conducted a survey, not yet published, among women living with HIV, mostly in the US, around reasons for their decisions to breastfeed or not breastfeed, and found similar trends to your findings. We also asked women about the challenges they faced if they were interested in breastfeeding or did breastfeed, and the top reasons were provider not well informed about transmission, lack of information for parents around breastfeeding, lack of support from healthcare providers, and fear of criminalisation. I'm curious if the fear of criminalisation arose or arises with the women you worked with. So we'll hear from both Germany and the UK. So Leela, maybe I'll get you to take this first. Is Leela there? Or am I going to have you again?
Leela, I'm here. I am here, sorry.
That's okay.
Forgot to unmute me. Thank you for this question, first of all. So I do have a couple of answers of women who said they felt very criminalized and had to fight very hard for the right to breastfeed. And I think there's a change since in Germany now breastfeeding is in the guidelines in that subject that if a woman wants to breastfeed, she should be supported. This is quite new for us. So now there's a trend changing that it's even a possibility to breastfeed. Before that, it was a no-go, and I think a lot of women chose to breastfeed and not tell anybody if they wanted to because of this feeling of being criminalized. Some women, because I have some women who breastfed a couple of years ago, their experience was much worse, I think, oftentimes than now. So it's getting a bit more positive, the experience. Not to say that there are not horrible stories right now, but a couple of years ago, it was a lot harder to get this through and to stand your woman and do what you want to do. So yes, there is this part, and I do have to report, for example, just one quick example. One woman decided to breastfeed and chose to tell everybody, and when she gave birth the next day, she had in her medication the medication that stops the lactation process without not her knowing that this medication is there. So that is something you can go to the police for, in my opinion, but something like this happens because some healthcare providers think they know best and do what they want to do. And of course, this is just one horrible example that happened. And yeah, there is this point. So maybe, Bakita, in the UK, you have similar experiences.
So, Bakita, any views from the UK?
Yes, so within the context of infant feeding whilst living with HIV in the UK, it isn't criminalised, apologies. However, so in terms of law, that wasn't an issue that was reported by participants, but nonetheless, some participants did still feel judged for their decision. And similar to some of the points that Leela made, that there were some participants who felt that they needed to self-advocate for their for their decision to breastfeed, and some reported bringing in and seeking advice from HIV organisations and support groups, and at times also other HIV healthcare providers from different clinics.
Okay, Patricia, are you there?
Yes, I'm here.
Do you want to take
Can you
questions now?
please, Vaquita, maybe complement your answer with a question from Ana Maria? If you think there's some lack of unwillingness from the healthcare providers to follow the guidelines, is a personal opinion plays a part?
I think that's a really important question, and I know the data is raising that as like a really important question. We, as a study team, we do have members of BEVA as part of our study team, and we've had conversations with the BEVA pregnancy committee to see how we can answer this question potentially, and figure out if it is an unwillingness, a lack of potentially a lack of awareness of the updated guidelines, especially for HIV doctors who may not see many pregnant women and birthing parents living with HIV. So I think that those questions around what support needs, yes, are needed for women and mothers living with HIV and birthing parents living with HIV, but also the support needs that might be needed for HIV physicians and the wider multidisciplinary team as well.
Thank you, Vaquita. And there's a question from Deborah to Lila. Could Lila please give us the outline of testing and following for women who breastfeed? Are there circumstances from when women are advised against breastfeeding?
Yes, thank you for this question. So normally we do have not stated now what kind of monitoring we would like to have during the breastfeeding period. So that's something on the to-do list, I think. So should it be every 4 weeks, every 6 weeks? What is after 6 months of breastfeeding? Is it still 1 monthly, or is it another time frame we should choose? But to say every infant should be tested and is tested 6 weeks after stopping to breastfeed. And so therefore, this is the end then. But during the breastfeeding period, there are different intervals in which every doctor wants to check on their patient.
Thank you, Lila.
So any other questions? Nothing else in the chat at the moment, so please send in your questions if anything still
I
want
have
to
a
bring
question
up.
I have a question for Lila. Do you think there is some issues with the pediatricians with the with breastfeeding?
Firstly, I would like to say there are very great pediatricians out there who do a great job. But personally, I do not treat HIV patients or HIV mothers. So I'm just doing this study, and I have another study, or we have another study before that. And yes, the experiences I can read are oftentimes that, I don't know why, but at some point, one or another pediatrician feels the need to care for their baby and do whatever it takes to protect their baby.
Yes.
I just can say what the women wrote to me, and this is oftentimes that they have bad experiences with their pediatricians. And I think it's interestingly enough that some women do not chose to not tell their pediatrician about the decision to breastfeed. I mean, that's something very important. But I don't know why it is like that, but obviously it is. I don't know why.
So Lila, there's another question for you that's a really a follow-on from this. Do you know if the decision to breastfeed was supported by their partners? And Vaquita, you might want to come in on this too. And whether the decision affected their relationship? Did you have any examples where there was tension between the partners?
Yes, I have data, and I can't remember if it's Helena, the first study, or the sister, I can't remember. But nevertheless, most of women told their partner that they are HIV positive and that they are breastfeeding, and most of them did have the support of their partners. So in this department, most of the time there were no difficulties. I don't know if Bakita has any different experiences.
Our experiences are quite similar, actually. So the only 2 participants reported that their partners were not aware of their HIV status. One thing that really came through strongly in the data was the importance of partner support in their infant feeding decision making, regardless of what decision they had made, whether that be to formula feed or to breastfeed. And other than the one participant who chose to breastfeed because she was worried about not breastfeeding signaling her HIV status, the other women who had breastfed said that their partners had supported that decision, and knowing that they were living with HIV.
I must say, I've had one patient where the woman was very keen to breastfeed, and her partner was very against it and felt that if there was any issue from the point of view of the baby, he didn't want her to breastfeed. And it caused a lot of tension in the relationship.
I can imagine. Yeah, I can imagine.
Okay, any other questions? Otherwise, I'll give you all a little bit of your evening back, and we'll move on to the next session. So thank you. I think they were a great set of presentations, and well done, all of you.
Thank you.
Thank you. Thank you to all of you.